Hey, this is Brad from NYC Pain MD, and I wanted to make this quick video here because there's some great treatments here, and I want to really simplify it so hopefully everyone understands it and it makes sense. Because as you know, sometimes when the really smart doctors talk, it goes over my head, you know. So I want everyone to know about this on the arthritis treatment. It's really cool. So let's watch this little video clip here. It's gonna explain some stuff with a little animation, and then I'll be right back.
Cartilage is the smooth tissue that covers the ends of bones in a joint and allows the bones to glide smoothly over one another. Cartilage also acts as a shock absorber. Also in the joint is a thick gel-like substance called synovial fluid. Synovial fluid lubricates, cushions, and protects the joint. As we age, or due to trauma, the cartilage breaks down and the bones begin to rub against each other. As the rubbing continues and the cartilage continues to break down, the arthritic joint becomes increasingly painful.
All right, so hopefully you understand that the cartilage wears out. You know, as we age, trauma and stuff, playing sports, and the pain can be extremely bad. If you're watching this, you probably have a lot of pain. And what we're trying to avoid is knee arthritis surgery, knee arthritis replacements. And on the left here, you can see arthritis. This is the replacement. And what they do is they have to cut into the bone and they have to drill. And there's a lot of stuff here. And knee replacement surgeries have come a long way, and some people need them. But if it can be avoided and you don't have to go through this, that'd be great. So if it's needed, you do it. But like I said, you know, we don't want to go this route if possible. So there's a great treatment, and what it does is it actually injects a gel into the joint space here and lubricates this joint here. So let's watch a video here of that. Let me pull it up on my computer. This is it right here, and this is the knee here, and the red stuff is the arthritis, inflammation, pain, and stuff. And so now you're going to see the doctor here. This is animation, of course, okay? But it's simulating the doctor putting a gel into this joint space. So I'm going to play it here. And there comes the gel. So let's do this again. I'm going to do this slow so you can see. So the doctor puts the gel right in here, and then the gel goes into that joint space, okay? Cushions this joint and allows it to move again without as much pain. The results from this treatment can be sometimes amazing, sometimes pretty good, and sometimes some people don't get any results at all. That's medicine. If anyone tells you that they have a treatment that is 100% and they're going to cure you and this and that, that's just not true. You know, I'm here to give you the honest truth. And sometimes some people, this treatment is incredible. Like I said, sometimes it doesn't work for you, but for most people, it's really worth a shot. And the best thing to do is to go into your doctor and have him take a look at you and examine you and see if you're a candidate for this or not. The biggest problem here is, as you can see, when they're going to put this gel into your joint, you see right there, it's precise, okay? If this was put over here, okay, it's not going to help you at all, okay? And that's why the doctors at NYC Pain MD use a special imaging, and I'll show you that here, imaging where they can pinpoint exactly where this gel has to go, and it's a digital imaging here, and they're very precise, so they can actually watch the injection go into the joint. Some doctors do it where they mark this, where they image you, they mark your knee, and then they take the imaging away and inject you. Well, if you do that, you're not going to know if the gel went into the joint or not. So what you want to do is, you want to go to a doctor who watches. You can watch the screen and you can actually see the gel go into the joint. A lot of people come to NYC Pain MD after they've had this treatment done already, and it didn't work for them. And then because they didn't have the imaging, okay, and they missed the joint, and they come to NYC Pain MD, they use the imaging, and they get the gel directly into the joint space, and it works for them. Okay, so it's very, very important that if you're going to have this procedure done, you go to someone who has imaging and who actually watches. You can watch the screen and you can see this gel going into the joint space. Okay, because as you can see here, if that gel goes directly into the joint space, the treatment's successful, and you have much greater chance of getting your pain sometimes eliminated, sometimes less. If you miss the joint space, like over here, there's no way this is going to work. Okay, so we want to make sure with imaging that these treatments are very, very, very precise. So basically, what's happening here is your joint is starting to wear out. Cartilage is starting to wear, and you're starting to rub. Arthritis is there, inflammation. The doctors are going to put a lubricating gel directly into your joint space. If they use imaging, they can see it. The treatments are extremely precise, and you have the best chance for success. A lot of people are getting great results with this treatment mixed with the imaging that actually had it failed before. What kind of results can you expect? Like I said before, in medicine, there is no treatment that is 100% for everybody. Okay, so nobody can guarantee that this treatment is going to eliminate your pain. Can't even guarantee that it's going to help you at all. But a lot of people who come in, and they've treated thousands here, a lot of people get out of some or all of their pain. A lot of people are who couldn't play golf are back to playing golf, tennis, activities, playing with their grandkids. It's not everybody. Once again, okay, I really want to make that point clear that the biggest thing about NYC Pain MD is that they don't exaggerate, no false claims. This treatment does work for a lot of people. It may be you, and the best thing to do is to give them a call and get a screening for free. They'll check you out for free and tell you if this treatment is likely to help you, okay? And then you can sit down, answer your questions and stuff. And you can call the number here, 800-301-4250, and they will set you up with a screening for free. But I'm going to pull up the website here. You can go to www.painmdny.com, and you'll see here numbers here to call. You can actually get a free information kit. They're located here at 65 Broadway Suite 1004, New York, New York. They actually have 2 offices in New York City, and you can check out this site here. And you can click on if you have knee pain, if you have back, they treat back pain too. You can click here to get a free information kit. You can even click here if you're on Facebook. If you click here, you'll be able to message, you'll be able to chat with somebody on there. I'm actually on there a lot, Brad. And you may chat with me, and you can ask me questions and stuff. So you can click this here, get connected with me or somebody else, an expert, and answer your questions. And you can set up your free screening here too. And you can check out the site here. It talks about them, some videos. They also do stem cell, PRP, a whole bunch of stuff here. So you can see if you click on the knee pain button, which best describes you if you have not had knee replacement surgery yet, or if you have had it. So you make a choice, and they're going to show you a video that's best suited for you. So if you have not had the replacement, you click here, and then it's going to show you a video that's best treatments for you. If you have had it, it'll show you a different one. You're going to go here, and that's the knee replacement. It's graphic stuff. The video, it doesn't show that. It just shows the picture. And if you've had back pain, then you can go to the back pain page, okay, and you can talk about, they have some very advanced treatments for back pain. You can give them a call. Free information kit. You can click this button here, and you can get your free information kit. Just put your name and email there. Click this button, and it'll be sent right out to you. I'm going to put the link for this site in the description below, and you can go there and check this out. But if you want to chat with me, go here and click send to messenger button. And as long as it's not 3 a.m., if it is, I'll get back to you in the morning. But if you click this button, I will get back to you usually within, usually immediately. Okay, but if it's the middle of the night, I'll get back to you in the morning. Okay, but we can chat about this. Questions that you have. Check out their site here. It has the map and everything, and that's it. I hope this made sense to you. And if you have any questions, message me there. You can call 800-301-4250, and you can get a free screening or information kit.